When we think about institutions that affect labor markets, we often think of labor unions. That's one of the biggest ones. Minimum wage, which gets talked about quite a bit. And then employment protections or preventing people from getting fired unjustly, things like that. But another major institution that we don't often think about immediately is occupational licensing. Now, occupational licensing requires workers to obtain government permission before practicing in a profession. So basically, licensing laws are designed to protect consumers from injury and from low-quality service providers. In order to legally practice in a licensed profession, an applicant has to go to the state licensing board and apply. They have to demonstrate that they meet education requirements, hands-on training, take and pass exams, pay fees, and even pass background checks. Basically, these laws require applicants to develop human capital related to their job ahead of time. And then once the licensing board approves the application, that license is a signal to consumers that they can be trusted. So if you remember back to Akerlof's Market for Lemons, if consumers cannot discern the quality of service providers, they will not be willing to pay the full price for the high quality providers. Over time, what happens is that the high quality providers leave the market, resulting in only low quality providers left, in the end, destroying the market. And even if this worst case scenario doesn't come to fruition and the market mechanism still functions properly to filter out low quality providers, it only does so after leaving a trail of broken bodies or injuries. So you have a lot of consumers harmed in the process of the market mechanism working. Now, an alternate view of occupational licensing that isn't quite so rosy is that they're created by incumbent professionals to restrict competition. So in this model, workers that are already in the occupation lobby for creating licensing requirements or stricter requirements once licensing already exists. They get grandfathered in, so they don't have to meet these new requirements, but new entrants do. And the result is that fewer new entrants increases wages for the existing worker. This is similar to how unions restrict the labor supply to raise wages. So one of the most influential empirical summaries of occupational licensing is analyzing the labor market outcomes of occupational licensing. What this paper uses that's different from past work is that they rely on the current population survey data, the CPS, which has a specific licensing variable. So the data set or the survey data set is based on directly asked workers whether or not they hold a license. Earlier studies had to basically infer licensing from the profession. So they estimate that licensing laws result in a wage premium of about 10 to 15% for licensed workers over similar unlicensed workers. Now, there are two possible explanations here. The first is quality. Licensed workers earn more because they have more training. They develop human capital, and they're higher skilled. There's also the barrier to entry explanation. Licensing restricts the number of workers that are allowed into the occupation. This relative shortage of professionals increases wages for those that, make it through and are able to practice. Most economists believe that both mechanisms play a role, but how much each of them play is up to debate. Which brings us to our next paper. How much of a barrier to entry is occupational licensing? So instead of focusing on wages, Blair and Chung study occupational licensing and entry into the profession, specifically focusing on supply. And Peter and Bobby's key question here is, how much does licensing prevent workers from entering an occupation? Well, it turns out the licensing significantly reduces entry. They estimate that entry into licensed profession falls by roughly 17 to 27% when a profession requires a license or when they add a license. This is an economically significant effect. This 17 to 27 is really large. The barrier is particularly strong for workers with lower income and workers with less formal education. To see how licensing works in practice, let's consider a specific occupation and turn to the third paper that I've included for this module page. So the effects of licensing on labor markets for opticians. And it uses a nice, clever title here. Opticians are workers who fit eyeglasses, they help patients select lenses, they adjust frames, and they do some work with contact lenses. Importantly here for Ed and Anna's analysis is that some states require licenses for opticians while others don't. And at the time, Texas required certification. So this variation provides a naturally occurring experiment. So it's as if we're able to randomly assign treatment and control groups to the individual opticians based on the different states adopting licensing requirements. So they compare states with licensing requirements for opticians to states with no licensing requirements. They find evidence that licensing reduces the number of opticians. So it's that restriction pathway. In licensed states, there are fewer opticians per capita, and as a result, opticians earn higher wages. Good for those opticians that are able to get through because they make more money, but it's not good for the economy overall because it's not because of an increase in productivity. Here they find that it's because of the restrictions on entry that wages are higher. And this gets passed on to consumers in the form of higher prices. And this is consistent with the standard supply and demand prediction that when supply is restricted, prices for those services rise. Now, licensing can be understood using a standard labor supply diagram, the kinds we worked with in the earlier modules. So without licensing, labor supply reflects all workers who potentially enter the occupation. But once we add licensing, entry requirements restrict who can work. This effect basically creates a leftward shift in the labor supply curve, resulting in higher wages for licensed professionals, fewer workers in the profession, and potentially higher prices for consumers.